Dr. Mallika Marshall has been a trusted source of information throughout the coronavirus pandemic, and she joins us now to answer some of your coronavirus questions. Doctor, we're going to start with Jim, who writes, I remember seeing a lot of news in the past about multisystem inflammatory syndrome in children thought to be triggered by the COVID-19 virus. But now I hear little about this. Why is it not being mentioned anymore?
So, Jim, it's still out there. And in fact, there are a couple of groups of U.S. scientists, including one here at Boston Children's Hospital, that just published a couple of studies in the New England Journal of Medicine looking at nearly 300 children with the syndrome. You know, it's thought to occur weeks after a child becomes infected with coronavirus. And while it's still very rare, parents are still encouraged to look out for signs like fever and rash in kids who've been infected with the coronavirus. If they develop those things, they need to call their pediatrician.
Yeah, because that is so alarming. Dr. Louise purchased a box of disposable protective masks that say that they block droplets and various microorganisms, and she wonders if they're safe to use.
So they're probably fine to use as long as you use them properly, that is covering your nose and your mouth, and I would throw them out every time you use them. I wouldn't try to disinfect them or wash them, but they should be okay.
All right, and Phil wants to know, can young children be carriers of COVID, wondering if it's safe for kids to go back to preschool?
You know, it's really unclear how many kids actually get infected with the virus and never develop symptoms. And even if that's the case, could they be contagious? Could they actually infect other people? This is a large area of research right now, as you can imagine, as schools are trying to figure out what to do in the fall. But it's another reminder that children over the age of 2 need to wear masks and continue to socially distance just like the rest of us.
All right, this is a very timely question. Patricia says she knows the numbers in Massachusetts are good, but is still concerned about staying at a beach house with 12 of her close friends at the end of July.
You know, Patricia, I would be concerned too, because it's not like you're talking about getting together with just a few friends on July 4th at the beach where you can spread out and socially distance. You're talking about being in a house with other people, a fairly large number of people, not wearing masks, not able to socially distance. And if any one of those friends is infected with the coronavirus, there's a very good chance that someone else in that house is going to get infected as well. So it's not something that I would feel comfortable doing right now.
Yeah, we all want to get back to our normal lives, but we still have to wait. Doctor, thank you. Dr. Mallika is offering her best advice, but you should consult with your own doctor before you make any decisions about your own health. If you have a question for Dr. Mallika, there are 3 ways you can reach her. First, email drmallika@cbs.com. You can also reach out to her on Twitter @Mallika Marshall, or you can Facebook message her, Dr. Mallika Marshall. Liam?